You can imagine the immune system is a car full of T cells, and you're trying to drive towards the tumor. And the goal is to get it there as accurately and quickly as possible. And so when we think in this framework, we can think about how are the ways we can do that? How are the ways we can get the car to where it needs to go? So one is we can release the brakes on the car, and that's really what immune checkpoint inhibitors do. That's the most common therapy that we use today. The other is you can press on the gas pedal of the car, and that's what immune agonists like cytokine therapies do. And cytokine therapies have a long history in kidney cancer dating back decades, but there's new, more clever sort of engineered forms of cytokines that really can effectively press on the gas pedal only for the cells that we want to sort of accelerate. Those are both great in terms of making the car go faster, but not necessarily turning it towards the tumor, getting it in the direction you need to get in. And so that's where adding a steering wheel comes in. And that's the idea of antigen-directed therapies. Can you figure out what specifically on the tumor cell can be recognized by the immune system and harness that to really direct the immune system to attack it? And that can take many forms, everything from antibody therapies and T-cell engagers to cell therapies like CAR T-cells, particularly allogeneic CAR T-cells, all the way to personalized neoantigen targeting cancer vaccines. And the very last thing I think about is clearing the traffic. If you have all the other things in place, if there's too much in the road and you can't get to where you need to go, that's a problem. And that's really all the T-cell extrinsic factors. So everything from suppressive myeloid cells to an unfavorable microbiome, all the things that might prevent T cells from doing the job that they need to do. And so if we think about those buckets, I think most of our current therapies and really the therapies that are in development right now really fall into one of those buckets.